A cavovarus foot is a description of how the foot changes with an imbalance between the muscles outside of the foot and the muscles within the foot. If you look at a normal shaped foot, it will tend to have a small arch in the middle, and at the heel will be pointing a little bit towards the outside from neutral. In the cavovarus foot, due to the imbalances between those muscles outside of the foot and within the foot, that arch becomes significantly more pronounced. The heel comes much more towards the midline, and that leads to multiple problems in terms of not only day-to-day management, but also just day-to-day activities. The cavovarus foot can cause a multitude of problems depending on the severity of the deformity. The deformity, a bit like a normal foot, can vary from patient to patient, and initially symptoms may simply actually be related to day-to-day pain, but also recurrent sprains because of an instability within the foot. As mentioned, the foot is becoming deformed because of an imbalance between the muscles outside of the foot and within the foot. As a result of that imbalance and the possible worsening of the deformity, children in particular have a variety of presentations and ultimately may struggle not only with wearing normal shoe wear, but also taking part in relatively simple activities such as PE, running, sports, due to pain and problems related to the feet. Most cavovarus feet are bilateral, and because of that, there is a genetic component to it. As part of any workup in analysing and assessing a cavovarus foot, there are a number of studies that are performed. These include both genetic inheritance analysis, but also looking at the spinal cord, as there may be a number of neurological abnormalities that can also cause this deformity. This is particularly true of those with unilateral or one-sided cavovarus feet, which need to be more closely analysed than the bilateral cases. A full analysis needs to be performed, if only so that we can be able to provide patients with the opportunity to predict what their overall course of the deformity will be, and as well as to advise them regarding what possible interventions may be most appropriate. Treatment is not always required. Ultimately, the initial management of this condition, as I've already alluded to, is to provide an underlying diagnosis for the cause of it. Once that is found, primarily supportive or accommodative treatments are made, such that these may be related to orthotics within the shoes, or making specific shoes to accommodate the foot itself so that children can take part in all activities that they wish. The only time that surgery is specifically indicated is if children are not managing day to day with these orthotics or with these supportive measures. Surgery for cavovarus feet is only indicated when all non-operative measures have been exhausted. However, that surgery varies from foot to foot, from patient to patient. For example, in patients who have a flexible deformity, it may be that only simple soft tissue releases are required in order to allow the foot to return to a more acceptable position. However, in some children, the feet may be so stiff that transferring the tendons might not be possible. And in those children, carrying out cuts to the bone, whether they be small cuts to allow the bones to be gently positioned in a more appropriate position, or cuts within such an apparatus as, for example, an Alizarov frame to pull the foot back into the right position, may be the most appropriate measure.